My name is Mike Drew. I live in Malkerns, and the start of my journey to the Luke Commission actually began, I think, on about the 8th of January. I say think because it's all a little bit blurred still. But basically, although I tried to social distance and wear a mask and hand sanitize, I started to feel unwell. My temperature seemed to go up, and if I was eating food I couldn't taste anything, and that told me something wasn't quite right. The other problem was when I was wearing a mask I couldn't breathe. I had to physically take the mask off, so my breathing was really difficult. So late on the evening of the 9th of January we came to the Luke Commission. I'd felt unwell for a couple of days, but because I'd taken the necessary precautions I didn't think it was COVID. But I had a rapid response test done and they confirmed it was COVID and probably the new variant. So because my breathing was so bad, it was very important that I got to a good hospital soon, and that's why I came to the Luke Commission. Things are still very vague, but I do remember arriving at the sort of reception area and the guy doing a number of tests, the doctor, and x-rays, and based on that information he decided that I needed to be admitted. So I was brought down to the COVID-19 area, and I remember there were two of us in the room, myself and this other gentleman, and all I can remember is someone saying to me, breathe, breathe. And the problem was I couldn't breathe. Much as I tried, I couldn't breathe. But I didn't know until later that actually one lung had stopped functioning and the other was at 25%. So the only thing they could do was pump oxygen into me. And on the first night, according to the doctors, I received 65 litres a minute, which is incredible. So the first 4 days, I remember very little. I know they were putting a lot of oxygen into me. I know the doctors were coming around frequently. I know they were doing a lot of tests. But then after 4 days, things became a little bit more aware, and I was more aware of the quality of medical care that I was getting, which was all the tablets, all the injections, everything they needed to do to get me functioning again. And that is just incredible, just incredible. Basically I kept fighting, so I got 3 sons in my own country, Wales, and I didn't feel it was my time yet. The difficulty I had was how much I actually told them. So I didn't want to make them panic, but at the same time I felt they needed to be aware that, you know, things weren't going too well. So I left it 2 or 3 days. There's a WhatsApp facility here, so then I was able to get in touch. So as far as they're concerned, life can now go on as normal, whatever normal is. But as far as I'm concerned, people really have got to take this disease seriously because it's an absolute killer. From memory, I came in on the 9th of January, and I think today is the 27th. So I don't know what has happened over the last 14 days really, so it's all been a bit of a blur. What I do know is that the Luke Commission, they have on their t-shirts something called compassionate medicine, and it's much more than that, much more than that. The treatment received has been absolutely exceptional, absolutely exceptional. And all credit goes to the doctors, but the rest of the team as well, the support staff, the nurses, the pastor, Brian, the occupational health. Between them, they have done a fantastic job, and I cannot thank them highly enough. The thoughts inside my mind, the first thing, funnily enough, I looked over at the guy next to me, and the first thing I thought was, well, you look to be in a worse position than me, because he was struggling so much. And in fact, at maybe 2 o'clock in the morning, they put a shutter up between myself and where the guy had been and discreetly took him out, so clearly that gentleman didn't make it. And for the next 2 or 3 days, I remember very little, but when I did start to come round again, I remember the doctor saying, you are a miracle. You should not have survived. So at the moment I'm coming to terms with the fact that I will never survive this, which is incredible. Incredible. And that will take time to sink in, I think. I think the one thing that stood out for me was the compassion of everybody. That they were so happy to help. And sometimes in this world that's a rare quality, but certainly at the Luke Commission it's you go into hospital and you think it's a negative experience. Actually, when I reflect on this in a week or so, I'll see it as a positive experience. Because I've met so many good people who do care. That is fantastic. I think one of the problems that Emaswati have is that they're not taking this disease seriously enough. And having experienced it myself, I can tell you firsthand it is a killer. And those that have died in a very uncomfortable way, because when you're constantly gasping for breath, that's not a pleasant place to be. Siyabonga, thank you. And that's one word that means little, or it can mean a lot. And as far as everybody here is concerned, that one word for me means an awful lot. I cannot put it into other word than Siyabonga. Siyabonga to all at Luke Commission.
Been nearly 9 months now since I was discharged by the Luke Commission. The message I want to give to all Emaswati is, do please get the vaccine, because you do not want to be in the same position that I was in back in January at the beginning of the year. Now, there's a lot of myths about the vaccine which I've read in the paper and I've seen on social media, that it's actually a muti, that it affects your reproduction system, that it gives you COVID, and that you shouldn't take it because it affects your soul as well as your body. None of those are true. The vaccine is there to protect you and to protect your health. I have now had the vaccine. The vaccination is painless. All I had for about 24 hours was a slight soreness in my arm, but nothing more. So sometimes it's good not just to look at what is happening in the country, but what is happening outside the country as well. So if you take the example of the United Kingdom, for example, where I come from, then they've made a big effort to vaccinate everybody, not just the elderly, not just the go-go's, but also the young people as well. And already they're seeing the benefits of this. They've been able to open up society. They don't have to go around wearing masks anymore. They can meet with each other. They can have meals together. They can actually go to work rather than sit at home. And if you do that, then actually society and the economy can start to open up again. And until we do that as a kingdom, then the problems with not being vaccinated are going to continue. So my message to all Emaswati is, please do not delay, because you're not just protecting yourself by having the vaccine, you're protecting your friends and family as well.